Welcome to Introduction to Pathology. This is a class for allied health students and paramedical students. It's just a brief introduction to pathology. Let's move on to the topic. So first we will see what is the definition of pathology. So pathology is derived from two Greek words. Pathos means nothing but suffering, or it is also called as disease, and logos means study. So it is nothing but study of disease, that is pathology. So in pathology, you are basically studying the changes which happen in the structure and function, of the cell. Like if we consider it a cell, then it comes as a group of cell, that is tissue, organ, and finally the body. So what happens if there is any changes happening in the body in a disease process? Definitely the normal thing of the body will be affected. That is, a normal anatomy, normal physiology will be affected. So when we are studying this, what is affected in normal, that we call it as pathology. So just know the name of father of modern pathology, that is Rudolf Virchow. So Virchow said that whenever there is any injury to the cell or stimuli given to the cell, there will be structural changes happening to the cell. There are certain changes which is happening to the cell, and likewise, like the changes will be happening in the tissue, organ, and finally disease will be caused. So basically you should know few terminologies, which you will come across pathology throughout your study. So first one is patient. Who is a patient? He is a person affected by the disease. That is a very basic term, patient. Next is lesion. What do you mean by a lesion? They are nothing but they are characteristic changes which will be happening in the tissues and cells produced by the disease in an individual. That we call it as lesion. Lesion means some changes happening in the tissues and cells. Next, coming to the morphology. So Rudolf Virchow also told that whenever there is a stimuli or injury happening to the cell, there will be some changes happening in the cell. That we call it as pathological changes or the morphological changes. This pathological or morphological changes can be seen in two ways. One thing, you can see it through your naked eye. What we call it as gross changes or macroscopic changes. They can be seen through your naked eye. Example, a patient will be a chronic alcoholic. He'll be drinking alcohol for many years. His liver will be damaged. So when such patient dies, and when you see the liver, you can see the nodules over the liver. So these are all the gross findings, macroscopic changes. Next, coming to the microscopic examination. So this is how you will take that one particular organ where there is some gross changes or macroscopic changes. Then you should process it. Processing you would have learnt in your labs. So how the processing will be done. The tissue will be cut from the organ. Then finally it will be fixed. After that it is processed, like it will be cut with the help of, then it will be embedded. Then finally microtome cutting. Finally it will go for staining, the routine hematoxylin eosin staining. Then it goes to the under the microscope where it is examined for the structural, cellular structural changes. What is happening at the cellular level. There are few other terminologies which you should be aware of in pathology. One is etiology, which you will come across in all the diseases. What is etiology? Etiology means it is the cause. What is causing the disease? That is responsible for the disease. That is what we call etiology. Without etiology, disease won't be caused. So etiology, that cause can be divided into two types. One thing, genetic causes, that is changes happening at the genetic level, genes level. Another thing is acquired cause. Acquired means which is acquired from the environment, acquired from outside. Maybe it can be an infection, it can be some hypoxia, it can be some chemical, it can be any environmental factors, all those things. That is a acquired cause. So etiology, that cause can be divided into genetic cause and acquired cause. Next, coming to one more term which you'll come across is pathogenesis. What do you mean by pathogenesis? See, pathogenesis is nothing but it is a mechanism. They are nothing but they are sequence of events. They are stepwise events which will be taking the etiology to the disease. Like it starts with the etiology. For example, there is some infection. Okay, it starts from there, that mechanism, the sequence of events, whatever happens in the cells, tissues and the body, those events will be included. That mechanism is included under pathogenesis. And finally, when the pathogenesis ends, the disease will be caused. That is the second term, that is pathogenesis. Next, coming to pathognomonic abnormalities. What do you mean by pathognomonic abnormalities? These are nothing but, these are the structural changes whichever is happening in the cell. They are very characteristic to one particular disease or one particular etiological process. Means if one disease is there, then this feature must be there. That is pathognomonic abnormality. Example I'll give. There is something called Hi-Fi disease. Okay, as of now it is like, for introduction it is too much. Rheumatic heart disease. Okay, it is a type of a heart disease. Okay, in that you will see one characteristic feature, that is Aschoff nodules. So likewise, that is nothing but a pathognomonic abnormality. That is nothing but it is characteristic to one particular disease. Now coming to clinical manifestations. Okay, the next terminology which you will come across in pathology is clinical manifestations. Clinical means what the patient will present, what you will see in the patient, okay, because of the disease. That includes two things. One is a symptom, another is a sign. So what is the difference between symptom and a sign? Symptom means what the patient complains, that is a symptom. Example, he is complaining of pain, that is a symptom. Okay, he is complaining of a fever, that is a symptom. So group of symptoms together form multiple abnormalities that we call as syndrome. Okay, so group of symptoms together called as syndrome. Okay, when fever is there, pain is there, everything group up together to form a syndrome. Next, coming to physical signs. That is what a clinician will discover. For example, rise in the temperature of the body. Physician will come, touch the patient and see, okay, there is a rise in the temperature. This is what physician or a clinician has discovered. That is what we call as sign. So this is the difference between symptoms and sign. Next, one more terminology which will come across is diagnosis. What is diagnosis? So it is a final answer. What has happened to the patient? This is what has gone wrong to the patient. That is nothing but called as diagnosis. It is with the help of many investigations, tests, what you do, you come to a final conclusion. Okay, this is a problem with the patient. This has gone wrong with the patient. So that is a diagnosis. What is going to happen? That is nothing but prognosis. That is nothing but the final outcome. Okay, the next terminology is the prognosis. The final outcome of the disease is nothing but prognosis. Okay, so disease is diagnosed now. Okay, this is the disease and you treat the disease or you will not treat the disease. What is going to happen? So the final end result, if you treat or if you not treat, that is a prognosis. Okay, what is happening to the patient? That's what we call, how is the prognosis of the patient? That is, if we are giving this treatment and how the patient can develop, that is or whether he can improve or not, that is nothing but prognosis. And what we do, that is a intervention, whatever we take, that is nothing but a treatment. And one more terminology is complication. What is a complication in the disease? Complication is nothing but it's a negative outcome which is coming out of a disease. See, if at all a disease is not going in a good way. Okay, example, some ulcer is there in the intestine, and because of that ulcer has ruptured out. Okay, it is perforated, bleeding is happening. That is a complication. This is a negative outcome of the disease. So that is what we call as complication. Next, finally, the spread. Okay, spread means the disease it has gone beyond the thing. Okay, so that is nothing but spread. Okay, this is nothing but the pictorial representation of the same thing, whatever I have told. The cause or the risk factor or the thing which is responsible for the disease, what we call as etiology, which can be divided into genetic and acquired causes. Next comes the mechanism, that is nothing but the sequence of events finally which will lead into the disease. Okay, that mechanism, what we call it as pathogenesis, finally the disease. So disease means what is manifestation? That is clinical manifestation, which can be in the form of signs and symptoms, and at the structural level, that is the morphological changes. Okay. Very important thing, subdivisions of pathology. You'll come across two words in pathology. One is general pathology, another is systemic. General means whenever some stimuli or injury is given to the cell, structural level, the basic reactions, whatever happen in the cell. Okay, that is considered the basic reactions. What is happening inside the cell now, structurally, functionally, what changes are happening, that we study under general. Systemic means it is disease specific or it is organ specific. Okay, the total overall what is happening in the body. Okay, so that is a systemic pathology where you will deal with the different system, maybe heart, lung, kidney, likewise. Okay, so these are the two different categories. Now the subdivisions of pathology, just some 5 subdivisions, the words you should be aware. What you will learn in histopathology, you know histo means something related to tissue. Here the other names for histopathology is anatomic pathology, which is further divided into surgical and forensic pathology, because you receive the tissues from the surgical side, that is OT, and forensic, autopsy, after postmortem you will receive the tissues. The other names are pathological anatomy, morbid anatomy, or tissue pathology. Okay, so I have already told the tissues will be received, then it will be processed, that is it is fixed, then it is cut, kept for fixation, after that it is embedded, then it is cut, stained. Okay, finally it will be seen under the microscopy, and sometimes you need to use some special stains like histochemistry to study the chemistry of the cells, or immunohistochemistry, that is where you are using some antibodies, okay, in immunohistochemistry for the antigens which are present in the cells to know the what has happened, okay, what has gone wrong. So anatomic pathology, as I told, it will be having many subdivisions, that is depends on the systems. Example, cardiac, breast, skin, that is dermat, gastrointestinal, and oral pathology. So next it is cytopathology. So I told histopathology means study of tissue. Cyto means study of cells. From where cells are coming? Cells are coming shed off from the any body surfaces, or that what we call shed off cells are nothing but they're called as exfoliation, exfoliative cytology, or cells are coming from fine needle aspiration, that is what we call FNAC, very important thing to look for any lesion you do with the help of a needle, that is fine needle aspiration cytology, or any cells coming out of body cavities, body surfaces, cysts. Okay, study of cell is nothing but cytopathology. Next is clinical pathology and hematology. There will be overlapping in this and can be included together. As we all know, hematology means something related to blood, okay, laboratory hematology, and clinical pathology will include the body fluids. Different body fluids are there. Pleural, peritoneal, all those things, urine, then semen, all these things, okay, they are included under clinical pathology. Immunology means something to deal with the immune system of the body and what is going wrong with the immune system. And one more branch, like one more division, is medical genetics, where the relationship between the hereditary and disease will be considered here, that is medical genetics. And finally, the study at the molecular level, that is at the level of nucleus, DNA, what we call polymerase chain reaction, in situ hybridization. Okay, they all are included under molecular pathology. Just know the terminologies, that's all for all these things. And not much explanation is required. Hope I have covered everything for basic requirement, and please revise the question papers, 10 years question papers for everyone. I'll tell, it may be allied health sciences or it may be paramedical. Please revise 10 years question papers. They are more required for the exam purpose. Okay, thank you.